Knowsy Neighbors fans, it is Jessica Cardon with Murdock Manwaring Company, your nosy neighbor. Thanks for joining us today. We are visiting a behavioral health clinic today. We are at Luke and Spencer Behavioral Health. This is a super important topic. This is probably something that nobody likes to talk about, and they don't necessarily talk about it in public, but our mental health and the health of the people that we love is so important. And these guys are gonna talk to us about what services they offer right here in Idaho Falls. We are at 1904 Jenny Lee Drive, so right up the road from the Apple, right off down from Lowe's, super easy to find. And these are two really great guys and a really great facility here to help us to keep it happy, keep things good, and if things aren't good for you, it's a great time to get in and take care of those things and be able to have that happy life that you desire. By the way, if you love local businesses like this one, like and follow the Knowsy Neighbors page. Go back and check out some of the cool businesses that we've taken, that we've highlighted, and visit these. These are your neighbors. These are your friends. They own these local businesses. Go check them out. And how we do this for free is we sell real estate. So if you're looking to sell your home or buy a home here in Southeast Idaho, we would love to help you. That's what allows us to highlight these businesses for free, is that we sell real estate to fund that. So if you're curious about the market, if you're wondering what's going on, it is actually probably the last time, we're in our last little bit to get a deal if you're looking to buy a house. And if you're looking to sell, you're wondering if it's the right time to sell. Interest rates have gotten people thrown off a lot. I will tell you, it is the time to talk about it. You're gonna regret waiting till the summer and saying, I wish I would have gone in and talked about it today. Because even if you're not ready today, let's make a plan. But I'll tell you, if you want a deal, you can always change your interest rate, but now's the time to get a deal on a house. So give me a call. All right, let's go in and let's talk to Luke and Spencer Behavioral Health, and let's find out about what the things that they offer. It says, whoa, hi guys.
Hello. Hi, how
Fancy
are you?
meeting you here.
Yeah.
Just hanging out in the lobby? So got nothing to do. So can we ask some questions about Luke and Spencer Behavioral Health?
Of course.
Fantastic. Tell us who you are.
So my name's Dave Spencer. I'm a counselor here in town and have been living here for about 10 years.
I'm Cody Luke. Been living in the Idaho Falls area for about 18 years, but from Southeast Idaho. I'm a licensed counselor and been working in the mental health field for 15 years, but been primarily doing counseling for about 5.
Gotcha. Okay, before I ask all the questions that I have, if someone needs your services, where do they go to find out more or make appointments?
Sure. So they can call our office directly. It's 208-974-5200. They can check out our website, lukeandspencer.com.
Is that "and" written out, or the
It
"and"
is,
sign?
yep,
Okay.
lukeandspencer.com. They can check out our Facebook page, Luke and Spencer Behavioral Health, or they can just come right into the office here at 1904 Jenny Lee.
Perfect. Okay, how long of a wait? If they need an appointment, how long are they waiting?
You know, right now with us being a new company, there's no wait times. Somebody could come in today and probably be seen within a week.
Wow, that's
so,
awesome.
Yeah, we know right now the mental health field is just really bursting at the seams.
Yeah.
And most places, if you were to reach out to them, it's like a 6 to 9 month wait, I'm hearing.
Wow.
So but right now we can get people in right away.
That's awesome. That's awesome. Okay, so when we're talking about coming in, what services do you offer? What are you offering? Who would be your client that would come in this way?
Sure. Well, our goal is to hopefully be able to offer services to anybody that walks through the door, right? Men, women, children, families, young, old, people struggling with mental health, people struggling with addictions. One of my specialties is addiction work. I've ran several substance abuse programs over the years, but also done a lot of mental health counseling. And so really it could be anybody who is struggling with mental health challenges or behavioral health challenges. Like I said, young or old. I know that addiction can be a big struggle. Anything from grief to trauma to anxiety, depression. I mean, all sorts of different services. So
Gotcha.
Yeah.
So we're looking at counseling for that. So if there is someone saying, is this the right thing for me? Do they have to have gone to a doctor before? Is this where they start? How does that start?
So we do have some doctors that will refer people to us, but that's not required. This could be a starting point for anybody.
If someone was thinking, okay, should I go in? What would be something that would indicate to them, I should check out, maybe I need some counseling? Are there any early signs? I mean, addiction
Sure.
might be maybe they're wondering if they do have addiction or not addiction,
Yeah,
but what else
yeah,
might be signs? Or if I have a loved one that I might suggest it's time to maybe talk to somebody.
Sure.
You know,
Yes.
that could be a really hard thing, you know, to even just tell somebody, because people could be offended by that,
Right.
Hey, I think you need counseling. But I really do believe that everybody can benefit from it at different points in life. There's that stigma that's out there with counseling, you know, mental health illness. And one thing that I really do appreciate is, you know, nowadays it's spoken of so much more than it used to be.
Yeah.
So anybody could come in, but if you're experiencing, you know, like loss of interest in things that you once used to enjoy, then that might be a sign to come on in. If you're having, you know, chaos, stress, family issues, marriage issues, you know, it might be worth just coming on in. And one thing that I like to offer before anybody fills out any paperwork, if they just don't know if this is even going to be a good fit, usually I just have people come in and we just sit down and we meet for 25 to 30 minutes, and they can ask me whatever questions. We kind of get to know each other. And if I feel like I'm not the right person, I have no hesitation to refer somebody elsewhere if needed. But if they come on in, they can kind of get a feel of what the counseling process might be like. We discuss all of that. And if they want to move forward, then from there we can start the actual process.
So can we take a look at, if someone was coming in and have a session, where are they going? How's that working?
Yeah.
So you check in first here.
Yeah, so they'll come in, they'll check in, and then
And you said they could walk in?
yeah, they could walk in. We have some intake packets right here. We also have a portal system where we can email them all the forms. But yeah, this would be the starting point.
Okay.
Yeah, so they'll come in for their appointment, have a seat in the waiting room. The counselor typically will just come out and grab them and bring to the office. You want
Let's
to see
go
some
do.
of our
Let's take a look.
All right.
So how many counselors do you have?
So right now we have Dave and I as the two full-time counselors. We have another two that we've hired part-time, and we're actually looking to grow and hire some more right now. So we can show you the building that we got plenty of office space for growth. But this is actually my office here. So
Did your wife decorate this?
Yes, the whole waiting room and everything.
I'm like, this is kind of pretty.
Yeah, that's her specialty.
Yeah, really
but we,
nice.
We try to make it as warm and inviting for anybody that wants to come in. Try to create a safe space as well.
Yeah.
And
Well, it's
a
very
place,
soothing in here.
Yeah.
The artwork is very
Yeah.
soothing. The colors, well done.
Yeah. So
Yeah.
so this is my particular office, and we'll show you
Yeah,
the
let's
building.
take a
And
look.
also show you Dave's room as well.
So if let's say, is this, when we think about counseling, Luke, Cody, we didn't ask you, what's your specialty? So we've got addiction is kind of in your realm, and counseling, what are we talking about with you?
So I'm more of like general health, general mental health. So anxiety and depression are two major things that I help people with.
Any age?
Yes, my preference, I guess, is, you know, teenagers on up. I started off with some real little kids and realized that there's other people that are better trained for that. But yeah, teenagers on up. You know, adults. I really do a lot of marriage counseling as well. But anything mental health, stress management, self-esteem. Anxiety,
I didn't think about
depression.
marriage counseling.
Yeah.
Because that I would think of mental health. I wouldn't necessarily put that in the same realm, but but that covers counseling in all ways.
Yeah.
Yeah.
So we do a lot of marriage counseling, some family therapy. We've done some groups as well, you know, maybe like a teenage self-esteem group, and we hope to be able to grow and do more groups and whatnot as well.
So if we think about kids and anxiety, that's a big deal, right? Anxiety, some depression, some those kind of things. Did you mention you do ADHD, as well? If their parents are just feeling like they're not being as successful, or they're seeing changes, or is it that they don't see changes, they just are wondering if they could be more, how would they know? Because sometimes as a teenager, you know, they're not telling you anything.
Sure.
Yeah.
You know, how do you make that choice and make that leap of saying, I think maybe we need to go talk to somebody, when all they say is, how are you feeling? Fine.
Yeah, yeah. Yeah, I think the biggest thing for parents to know is when you're seeing your kids really struggling with things, if they're doing poorly in school, or if they're making friends and then losing friends quickly, or not able to maintain those friendships, right? Or having other issues in the different areas in which they function, right? The parents might be able to see that. But I think it's super important for parents to be having that as much contact and communication with their kids as they possibly can, right? Sitting down with them, just having those heart-to-hearts, like what's going on, right? And there's going to be times where the kids don't want to talk about it, and that's fine, right?
Or they don't know what's going on.
Or they don't know what's going on,
I feel like that
right?
sometimes is, I don't know
sure.
what's going on.
And so they can come in, right? We can provide family counseling, we can provide some psychoeducation, help teach communication skills or conflict resolution skills or things that might be able to, kind of help people be more successful in the home, in school, out at work or wherever.
Yeah, interesting. All right, let's walk this way.
Cool.
Now let me ask questions. How much does it cost? So you said a free 30 minutes if someone needs kind of their initial determine. What are they expecting to
so it's really going
charge?
to just depend on, what health insurance policies people have. We do accept major insurance companies. We accept Medicaid, Medicare. We also provide intern counseling, which is a free service for those people who do qualify.
What does that mean, intern counseling?
Yeah, so an intern would be somebody who's in a graduate program to become a therapist. They're not yet licensed, but they're supervised by someone like me or Cody who is licensed.
Gotcha.
And so they have to see, clients throughout their program and learn those skills so that hopefully when they graduate, they can be able to just jump right in and be able to provide those services for people. So,
awesome.
Yeah.
So they just call in and you kind of work with them on whatever their situation is. Like if they don't have insurance, they could.
For sure.
What if they're private pay? What if they're not open for the intern program and it's private pay? Is that any idea what, like if they're coming in, what are they expecting to pay?
Yeah, so,
It depends.
It depends. I kind of lost my train of thought there.
Works.
Well, we offer 45-minute sessions. We also have hour-long sessions. So a private person that does not want to utilize the intern, a 45-minute session is typically around $90 a session. An hour-long session would be $120.
Gotcha.
But most people either have insurance that they want to use, or if they don't, they like to use the intern.
Makes sense. Okay, this one's your office.
This is my
Dave.
office. Yep.
Really
Come on
nice.
in.
Did Cody take the corner office? Wow, that was hard. I'm just kidding.
Paper, rock, scissors, right?
It's nice.
Yeah,
They're very
cozy.
soothing again.
This is cozy.
Really?
So, yep.
You guys have a good designer.
Thank you.
It looks great.
So.
Fantastic. So they this is where everything happens. When they come in to meet, this is where
we really value privacy, right? And we want people to feel safe. We want people to feel comfortable. So if the room is noisy, if there's people outside yelling and things like that, like we really want to try to avoid that. So we're just trying to maintain nice kind of peaceful, calming effect, right? We also have sound machines outside of our offices that kind of may provide some kind of static so that people walking down the hallway can't be listening to the conversations and things like that.
So you can feel like if you're in here, it's private.
Yeah.
Yeah, very important.
Yeah.
Awesome. All right, let's keep touring around. Okay, question. What are you guys' designations? So when someone says, I'm coming to see you, what is that? What you got all these letters behind your thing. What does that mean?
Yeah, so the letters next to my name are LCPC. So yeah, licensed clinical professional counselor.
Okay.
So I'm a licensed clinical social worker.
So what's the difference? We'll keep walking this way. What's the difference between the two? Why would they come to Cody versus Dave?
Sure.
Besides Dave's stunning good looks.
Ultimately, we can all kind of do...
These guys didn't know I'm funny.
These are just empty offices for growth as well.
For possibilities. I love it.
Yeah, for sure. Ultimately, we can do very similar services as far as like psychotherapy and some of these other mental health services. Really where some of the differences might be between like a professional counselor versus a clinical social worker might be maybe the school that we were trained at, the different, the license designation, but the different maybe skill sets that we have. Ultimately, as long as there's someone who's gone to a graduate program, has a master's degree in some kind of a social science field, then they can provide those services.
Kind of comes under the counseling session, then you decide what might be your specialty. So what's the difference between a counselor, a social worker, a psychologist, psychiatrist? What would you do? What's different about those? Yeah. I've always wondered this. Yeah. This is a great time. Thanks for answering all these questions.
So a psychologist is going to do more testing. That's primarily, I mean, they can offer, and they do offer counseling, but a psychologist does a lot of more of the psychological testing. So I'll have people that will come in here and, within an hour's time, we'll do a diagnostic assessment. But if there's some things that they can't quite tell if they meet this criteria or that, or maybe if they want clarification on a diagnosis, I will refer them to a psychologist for testing. And that's where they get more clarity and in-depth testing, really. A psychiatrist, once again, can offer counseling, but they're usually the ones that are providing medication management. So if somebody needs like a psychotropic medication, for anxiety, ADHD, bipolar, schizophrenia, those sorts of things, they're going to see a psychiatrist.
Gotcha. So if they need medication, do you refer out as a result of that for you guys if they're coming in? Okay.
Yes.
All right. That makes sense.
Sure.
Gotcha.
So yeah, I'll speak with my clients all the time about having a consultation with psychiatrists, and we'll definitely refer them.
And you've got people that they can go to here locally that could help
Absolutely.
them. That's awesome.
Absolutely.
That's a good clarification. I didn't know all of those things. So a counselor is more the treatment part.
Yeah.
Am I getting
The
that?
behavioral health treatment, the counseling, yep. The psychiatrists have, they've been to medical schools, or they've got that medical degree, and it's, the nice thing about having these different professions, right, is that we can all work as a treatment team, right? So if the client needs medications, they can go there. If they also need therapy, they can come here, and then we can do what we can to collaborate with those other professionals to kind of help provide the best care for that client that we possibly can.
Makes sense. All right, let's walk out this way. Okay, so kind of a hot buzzword right now on all things of depression and anxiety.
Yes.
That is kind of the buzzword of those things. I know a lot of times it used to not even be able to identify. You didn't know what it was.
Yeah.
So is the first step counseling? If you are suffering with some anxiety, depression, or what about like even the seasonal depression stuff?
Yeah, absolutely. I think that is the first step, really. Come on in. Now, you'd asked a question earlier that I'm going to go back to and answer. I think it kind of ties in.
Did I just move on without an answer?
No. You got an answer, but I think it ties into this as well when you're saying this first step, and you were asking about like parents. What about parents where their kids are only giving them one-word answers? That could definitely be a sign that something's going on, and they just may not be comfortable talking to their parents about it, right? And so parents need to be aware of that. If they can say, hey, you know what, I've got this teenage son or daughter who might be going through something that they don't want me to know about. I think bringing them into counseling, and we let our clients know that this will be between you and I. So we try to provide that safe environment for them, knowing that now there's limits to confidentiality, but to know that, hey, this will be confidential, that Cody's not going to call mom and dad and tell them what's really going on. Yeah. But parents have to understand and accept that as well, for the trust and for the help of their son or daughter. Yeah,
that's a hard line.
But yeah, so I think parents should know that as well. And then even as adults, having anxiety does not mean, or any kind of mental illness does not mean that you're crazy or you can't live a fulfilled life. We all understand physical illness, but for whatever reason, a lot of people just don't understand mental illness. Yeah. But yeah, if you're feeling anxious, depressed, focused, or unable to focus and concentrate.
What if it's always been that way? So this is one of those interesting things. Is in our world in sales.
Yeah.
This is also a hot topic. Is the ADHD thing, right? Yeah. Is that you get in sales? A lot of people in sales are drawn and have that personality that is, I'm a people person, and people, that's what they've called it. I'm a people person, which means I need to move around. I need to do those kind of things. Is that something that is an ADHD thing?
It could be, and I think one thing that people don't quite understand is that when someone has what we might label as like a mental challenge or a mental illness, that it causes problems, right? It's like it's a negative thing, right? That's kind of the label that we attach to that. But there are so many things within, like for example, ADHD that could be turned into a strength, right? And a lot of people will find those kind of niches that work for them. Just because you have something doesn't mean that there's necessarily anything wrong with you, right? But maybe you have problems in certain settings, and maybe it helps you thrive in other settings. So I think that's one thing that can be helpful, is to understand kind of some of that.
And sometimes it's not always medication driven. I think a lot of people will worry about that.
Yeah.
Is if I go in, it means someone wants me to take a pill.
Yeah.
And I'm not going to take pills.
Yeah. Yeah, medication has its place, but if you can get some help without the medication, then that's primarily what I think people want. Now, you just said, what if it's always been that way? Right?
Yes. What if you've always felt that way, so there's nothing weird?
Yeah. So I actually was working as a paraprofessional in the mental health field before I realized that I've always had anxiety myself. My entire life I've had it, and as I reflect back on it now with my education and the experience that I have.
You were a worrier as a kid.
Yes. Still am. Still am.
Interesting.
And I think about, even being in school, like in high school, and being that class clown was kind of what I was. I think that was more of a defense mechanism, right? If I can be a little sarcastic here towards the teacher, then maybe the teacher's not going to really call on me, and therefore I might not look as dumb to everybody as I think maybe I am if I don't understand, right? And I think there's a lot of that I had no idea that was going on.
Interesting.
Right?
Yeah.
So sometimes people are just like, it's always been this way. I've always had it. Well, that's okay. We can pull out the strengths from it. Like Dave was saying, there are, there's like going back to anxiety. There's healthy levels of anxiety. That's what keeps us. That's why we look both ways when we cross the road, right? Because if I don't, something bad could happen.
But what if I can't go to sleep at night?
Correct. And so there's also the unhealthy levels of it as well that we can work through. And
I think as we get older, maybe there was anxiety as kids and those kind of things, and maybe it wasn't crippling. But as you get older, sometimes that flares, would you say?
Sure.
And all of a sudden now you lay in bed at night and you don't sleep well and you don't, and everything can trigger those kind of things.
And we see, if something's particularly stressful, let's say you did have some symptoms of ADHD that aren't super problematic, well, you add some stress to that, you maybe add some trauma or something that's really stressful going on, then that can kind of exacerbate those. And then you start realizing, this is kind of problematic, maybe I need to look at figuring out how to kind of resolve some of that. And being able to come to a therapist and having somebody who might be objective, somebody who's not necessarily invested in emotionally, in your life, not to say that we're not compassionate and that we don't care about people, right? But to be able to look at the situation rationally and to help people see that. That's actually one of the things that I get people saying, like, it's so nice to be able to come to somebody who's objective, who doesn't know me, right? That isn't going to...
Doesn't have their own agenda somewhere in there, right?
They're not
Even though you don't want to,
say things just to make me, feel like everything's okay, right? That someone who can challenge me, right? Someone who can confront me on my issues, and that's kind of, I think, what a lot of people are looking for.
Awesome.
So,
all right, what did we not talk about? Anything we missed that I was supposed to ask and I didn't? That you're like, ooh.
Well,
I think we covered everything that I was hoping to cover. Yeah.
Awesome. So I love that idea that someone can get in quickly.
Yeah.
Because that might also be the issue they might have in an urgent need, and because of a delay, then it just gets shoveled under the rug.
Yeah.
So that's awesome. So again, how do they make an appointment if they want to come in and talk to you guys?
Yep. So again, the number is 208-974-5200. They can also check out our website, lukeandspencer.com. They can even message us through our Facebook page, Luke and Spencer Behavioral Health.
All links are below.
Or they can just walk right in.
Or walk right in.
Yeah, they can just walk right in.
Walk right in and say, hey, I'm having a breakdown. Who's available?
Yep.
I'm just kidding. That happens
That's the way
to
it
me.
works. Yep, that's the way it works.
You're going to have a flood of real estate agents. No, I'm just kidding.
That's right.
Well, that's awesome. Thanks, you guys, for your time. Really great.
Yep.
Okay, check it out again. You guys, all the links will be down below. So if you want to make an appointment or you want the phone numbers down there, take a look. Why suffer through? Why, if you've got something going on, again, why not get in and start taking care of things and take your life back to either where it was or into a better situation. So come check them out. Come and see Dave and Cody here at Luke and Spencer Behavioral Health. This has been Jessica Cardon, your nosy neighbor, keeping you in the know. It's Jessica Cardon, your nosy neighbor. If you'd like to know the value of your home, go to the site below or call me today.
The Nosy Neighbors, keeping you in the know.
The Nosy Neighbors, keeping you in the know.
The Nosy Neighbors, keeping you in the know.
So the Nosy Neighbors, keeping you in the know.